Hi everyone, I'm Dr. Jyotsna. I will be telling you about cycling. Cycling is the variable by which ventilator understands that it has to stop inspiration and open the expiratory valve so that patient can exhale. In volume control mode, once the set volume is achieved, inspiration stops and exhalation valve is open so that exhalation starts. In pressure control mode, time is the cycle. Once the TI is reached, exhalation valve open and exhalation starts. In the pressure support mode, once the percentage of peak flow is achieved, that is generally 25 to 30% by default, exhalation starts. Thank you.